next topic is the concept of the importance of mentors. And mentors come in all different forms and levels. So oftentimes you'll realize that you'll think that your best mentor is the attending physician, and you'll find out that on a practical basis, one of your best mentors may be one of the nurses on the floors. And one of the things you need to start doing is getting along with staff. It's really important. As a third year and a fourth year, you'll start to meet physicians that really excite you, both because of the field that they're in and also their teaching and how they interact with patients. And it's really funny, you learn these techniques from these mentors and you start to hear things that are really important. So when I was a resident, there was this older GI guy. He was the first chief of gastroenterology at Beaumont. And he used to say to me, and it was funny that it stuck with me, he'd say, you run from room to room because you're so busy. But when you walk into the room to see a patient, you go in slowly so that that patient thinks you have the whole time to spend with them. That patient has your full attention. And it's funny, I never forgot that. It turned out I didn't even like the guy, but he taught me all this great stuff. And I knew I didn't want to be a gastroenterologist. These things stick with you. And you see how these people relate to patients, and you see the things that they say to patients, and you learn from that. You develop these wonderful relationships. My mentor, I was the luckiest person in the world. My mentor was an oncologist at Providence Hospital, and I was 18 years old, and I was the autopsy assistant, one of the autopsy assistants at Providence Hospital. I knew I was going into medicine, and he took me under his wing. He used to come to all the autopsies of any of his patients, and as an oncologist, he was busy in that regard. And he would ask me questions, and he would actually tailor the questions to my level of education as I went along. And then he became the head of oncology at Beaumont Hospital. His name is, he's deceased, his name was Freeman Wilner, and most of the guys you see at Beaumont Hospital, at least many of them, trained under him and revered him. And I actually had the opportunity, his son was thinking of not going into pre-med, and we were both working at Providence Hospital, and he says, I want you to talk to my son and persuade him to go into medicine. And I did, and he's an anesthesiologist now in Dearborn. So these relationships become very satisfying and very long-term, people that you look up to, and it's something that you need to start looking for because it'll actually identify for you the specialty that you might want to go into.